The behaviors you think are cute or quirky could actually be your dog begging for help. It sounds dramatic, but vets see the fallout of missed signals every single day in their clinics. In this video, we're going through 10 hidden red flags disguised as totally everyday dog behaviors. And number 3 is something almost every dog owner has seen, but almost no one takes seriously enough. So if you love your dogs, please like and subscribe to help spread the message. Now, let's get right into it. Number 10. Eating grass isn't just a thing dogs do. You've probably seen your dog dive into the grass like it's an all-you-can-eat buffet and thought absolutely nothing of it. Here's the thing though. A 2008 study published in Applied Animal Behavior Science found that less than 25% of dogs actually vomit after eating grass, which means most of them aren't doing it to make themselves sick. They're doing it because something inside already feels off. Frequent grass eating is one of the quieter signals of nausea, gastrointestinal distress, or a real nutritional gap in their diet. Think of it like your dog reaching for the medicine cabinet, except they can't tell you what hurts. If your dog grazes occasionally, that's usually fine. But if they're out there every single day going to town on your lawn, that's your cue to pay closer attention. Check their food label and ask yourself if their diet actually covers all their nutritional bases, and if the grass eating is obsessive or followed by a lot of lip licking or drooling. Get them to a vet sooner rather than later. Number 9. That guilty look is actually fear. Let's clear something up right away. Your dog has never once felt guilty in their life, and that's not an insult. What you're actually seeing when your dog gives you those big droopy eyes and a tucked tail is pure fear. Dogs are incredibly good at reading human body language, and the moment your voice changes or your posture stiffens, they pick up on it instantly. That guilty look is their way of saying, "Please don't be angry," rather than, "I know I did wrong." Here's where it gets important. If you keep punishing your dog based on that look, you're not teaching them anything useful. You're just teaching them to be afraid of you. Over time, that fear quietly chips away at your bond and can actually build into a deeper anxiety problem. The real fix is to manage the environment instead. Put the trash can away, close the bedroom door, remove the temptation entirely. Your dog isn't being sneaky, they're just being a dog, and they deserve a home where they don't have to walk on eggshells. Number 8. Scooting across the floor. Go ahead and laugh. Everyone does the first time they see it. But once you know what's actually happening, the scooting stops being funny pretty fast. According to a study in the Journal of Small Animal Practice, anal gland issues are among the most common reasons dogs visit the vet, and scooting is the #1 sign owners finally notice. Your dog has 2 small glands on either side of their rear that are supposed to empty naturally when they poop. When those glands get blocked or impacted, the pressure builds and it becomes genuinely uncomfortable. So they drag themselves across your floor, trying to get relief. Parasites and skin irritation around that area can cause the exact same thing. So scooting doesn't always mean glands. It just means something back there needs attention. If it happens once or twice, monitor it. If it becomes a regular thing, a vet visit is non-negotiable because impacted glands can abscess, and that's a painful and expensive problem that could have been caught early. Also, high-fiber diets can actually help some dogs express their glands naturally, so ask your vet if a dietary tweak might help long-term. Number 7. Sudden clinginess or Velcro behavior. Picture this. Your dog has always been pretty independent, happy to hang out in another room, unbothered. Then one day, they start following you everywhere. To the kitchen, to the bathroom, to the couch, back to the kitchen. It feels sweet at first, right? But sudden clinginess in a dog that wasn't clingy before is actually one of the more reliable signals that something has shifted internally. Pain is a big one, because dogs in discomfort instinctively seek closeness with their person as a way of feeling safe. Cognitive decline is another hidden cause, especially in older dogs, where confusion makes them anxious and they anchor themselves to you as their one familiar thing. Early-stage anxiety disorders can also present this way before they escalate into more obvious symptoms like destructive behavior or aggression. The key word here is sudden, because a dog that has always been a shadow is just a shadow. But a dog that becomes one out of nowhere is telling you something changed. Watch for other subtle signs alongside the clinginess. Things like changes in appetite, restlessness at night, or hesitation going upstairs. Put all those pieces together and bring them to your vet, because the earlier you catch what's driving it, the better the outcome. Number 6. Constant licking of paws or legs. Here's a question. When did you last actually look at your dog's paws? Not just a glance, but a real look between the toes, at the skin, at the nails. If your dog licks their paws or legs repeatedly, that's not self-grooming. That's a message. Allergies are the most common culprit, and they're sneakier than most people think, because dogs with environmental or food allergies often show it through their skin first. Repetitive licking in one specific spot can also point to localized joint pain, where your dog is essentially trying to soothe an area that hurts from the outside. Left unchecked, that licking creates a whole new problem called a lick granuloma, which is a raw, thickened patch of skin caused by the licking itself. It becomes a painful cycle that's genuinely hard to break without vet intervention. So if you see your dog going after the same spot day after day, don't wait it out. Number 5. Sleeping way more than usual. Yes, dogs sleep a lot. A healthy adult dog sleeps anywhere from 12 to 14 hours a day, and that's completely normal. But a 2019 study in Frontiers in Veterinary Science found a strong link between increased sleep and early-stage illness in dogs, particularly conditions affecting the thyroid and heart. The tricky part is that the shift happens gradually, so you don't notice it all at once. One week, they're a little slower. The next, they're skipping their walk enthusiasm entirely. Hypothyroidism is one of the quieter culprits. It slows everything down from the inside, and lethargy is almost always the first sign. Heart disease and internal infections also drain energy long before any other obvious symptoms show up. The practical move is to actually track it. Take a mental note of your dog's normal energy level on a good week, and use that as your baseline. If they're sleeping noticeably more than that baseline for more than a few days straight, that's worth a conversation with your vet. Number 4. Head pressing against walls. This one is different from everything else on this list, and you need to know that right now. Head pressing, where your dog walks up to a wall, a piece of furniture, or a corner and just stands there pressing their head against it, is a neurological emergency. It's not quirky, it's not them being weird. It's a direct signal that something is wrong with their brain or nervous system. Causes include toxic poisoning, a brain tumor, encephalitis, or severe liver disease that's affecting brain function. If you ever see your dog do this, even once, don't wait until morning and don't Google it for an hour. Go to an emergency vet immediately. This is one of those behaviors where speed genuinely changes the outcome. Number 3. Drinking more water than usual. Most people never track how much water their dog drinks, and that's honestly one of the easiest health checkpoints to overlook. A sudden and noticeable increase in thirst is one of the earliest clinical signs of some serious conditions, and according to research published in the veterinary journal, polydipsia, which is the technical term for excessive thirst, is one of the top 3 reasons dogs are flagged for further testing during routine checkups. Diabetes, kidney disease, and Cushing's syndrome all show up this way before almost any other symptom appears. A quick and practical way to monitor this is to fill your dog's bowl to the same level every morning and check how quickly it empties. If they're draining it way faster than usual over several days, that pattern matters. Don't assume it's just the heat or that they had a salty treat. A pattern of increased thirst deserves a vet visit and a simple blood panel. Number 2, yawning in normal situations. A yawn during a lazy Sunday afternoon, totally fine. But if your dog yawns repeatedly during a walk, around new people, or in the middle of a training session, that's a completely different story. In dog body language, yawning is what's called a calming signal, a way dogs communicate stress and try to de-escalate a situation they feel uneasy about. So when your dog yawns while you're teaching them to sit, they're not bored, they're overwhelmed. Chronic stress signals like this, when ignored, can quietly build into more serious anxiety disorders over time. The fix starts with noticing the pattern and asking what's happening in the environment when the yawning kicks in. Scale back the pressure, shorten the training session, or remove the stressor entirely and see if it changes. Number 1, tilting their head to one side. Constantly. Everyone loves a head tilt. It's basically the internet's favorite dog moment. But here's what vets actually see when a dog tilts their head and won't stop. A possible sign of vestibular disease, a serious ear infection, or in more alarming cases, a lesion in the brain. The vestibular system controls your dog's balance and spatial orientation. And when something disrupts it, a persistent head tilt is one of the first things that shows up. What makes this so easy to miss is that it looks so endearing that owners photograph it instead of questioning it. The difference between a cute, occasional tilt and a red flag is consistency. If your dog is tilting to the same side repeatedly, especially paired with stumbling, eye flickering, or nausea, that combination is urgent. Vets report that this single behavior brings more dogs into emergency care than most owners would ever guess, simply because it was admired for too long before anyone acted on it. Now you know the hidden signals your dog has been sending you all along. But catching the red flags is only half the job. The other half is doing the right things every single day to keep your dog truly healthy and happy. So go ahead and check out our next video, where we walk you through 12 daily habits your dog desperately needs from you. Miss this one, and you might be doing everything wrong without even knowing.